Thanks, Mr. Chairman. This was not the topic I was going to come to address today, but my dear neighbor from Wyoming raised Denver Health, and I feel like it's really important for me to respond. I want to make sure I do that before you leave. First of all, Denver Health is a national treasure. I don't think the doctor would disagree with that. It is a critical public access hospital for the western United States, not just Denver. It serves the entire metro region. It has a massive problem because of the amount of uncompensated care it's covering, even without the current immigration crisis that we're talking about, because we, unlike every other industrialized country in the world, don't have a system of health care where people know they have insurance, where people know they can get care. And so the doctors and nurses at Denver Health are left to cover the uncompensated care that no one else will cover, because no private insurance company will cover it or no other hospital will cover it. There is Denver Health sitting there in the middle of Denver, not just covering it, but saying, send me the people that are uncompensated because we have a moral obligation to cover them. By the way, the taxpayer covers that care too. It's not like the taxpayer is somehow off the hook. We're paying for that because of our broken healthcare system. So what I would say to my colleague from Wyoming is, let's work together to fix our healthcare system so we don't have the immoral crisis that we have because people aren't covered in this society. That's point number one. Point number two, it is not Denver Health's responsibility, or dare I say, I think the Secretary would agree with this, Denver's responsibility, or even Colorado's responsibility to fix the immigration system in the United States of America. The founding fathers of this country understood that Congress would have to fix the immigration system in this country and be responsible for it, because even in the 18th century, it would have made no sense to imagine that this was something we would leave to the states or to cities or to a public hospital in the middle of Denver, Colorado to address it. We just had the opportunity to try to fix some of the chaos at the southern border of the United States, which I completely agree the American people are tired of, for good reason. I don't think that we should be allowing transnational gangs to set the immigration policy of the United States of America. I think that is a mistake. And because we have failed to act, that's who's running the immigration policy for this country in some respects. That's why so many people are showing up to the border. That's why the border is overwhelmed. And in the context of this Ukraine negotiation, we had the opportunity to try to address this in my opinion, a very incomplete way, but we were going to address it. And the other side walked away from their own negotiation, even though it was the quote-unquote toughest border bill that ever had been agreed to. And now they're coming here and beating on Denver Health for the uncompensated care that they're providing, because that's what honorable nurses and doctors do. That's what an honorable community does. It's the responsibility of the federal government to deal with this and not just to point fingers at each other. And I'll say, I wanted to ask you about mental health, Mr. Secretary, and the mental health epidemic that is raging among adolescents, young people in Colorado and across this country, something that we have to address as well. But let me mention one last thing before my time has expired, and that's this. 2 weeks ago in the Wall Street Journal, okay, not the failing New York Times, not Pravda, but in the Wall Street Journal, they had a poll on immigration. And they asked 8 policies of the people who took that poll in the Wall Street Journal. for the American people's support. Number one, with 74%, was a pathway to citizenship for the 11 million people in this country that are undocumented. The people that have spent 30 years in Oregon and in Colorado picking fruits and vegetables. The American people have too much common sense not to know that's a good idea. Second was the Dreamers. Third was dealing with the border. My point, and I'll stop, Mr. Chairman, is that we need a comprehensive solution to this problem. It's well understood we can come here and score political points. We have to fix the problem, and Denver Health deserves the support of this committee, not an attack on the work that they're doing.
As much as I agree with Senator Bennett's common sense, we have to move on to Senator Blackburn.